Health and wellness tools are really important for patients and consumers. When looking at Georgia's standing on many public health statistics, on many of our health outcome indicators, we generally don't perform that well. And so if there can be more tools for patients and consumers to find out how they can better access exercise, healthy foods, and keep track of that, that can only help with their own health and the health of the state in the long run. It is part of our mission to improve that through public policy, and the work of the Georgia Health Information Network is really important because it really gets at the quality side of healthcare, which is just as important as coverage and access to care. And we know that there are a lot of difficulties that patients can encounter that might have to do with either duplication of services or unnecessary services, or care that wasn't properly coordinated. Perhaps they might not really their providers may not have a good handle on all of the care that they're getting. So this is really an important piece of the quality side of healthcare, and again, sort of looking at coverage as an important piece of healthcare access, being able to see a provider, but also having good quality care when you get to a provider. So the work of the Health Information Network is really pretty critical to the quality side, and it is our hope for Georgia in the next 10 years that we'll have more people who have health insurance, we'll have more people who have access to the healthcare system, and overall we'll have better quality indicators as a state. Looking at reducing healthcare costs, improving quality in the patient experience, and improving population health. And there's much that we're monitoring and advocating on now around healthcare coverage and access to care, but the quality side is so important too. And that some of the barriers with respect to quality come from lack of coordination, and part of that is because patient records are not always electronic. Providers may have to do tests that have already been run because they didn't have access to the previous test results. Drugs may be prescribed that conflict with a drug that another provider has prescribed because there isn't that knowledge of the coordination. Patients may have to undergo multiple tests, etc. So having an electronic health record and having this kind of network across the state will really improve quality, and that's really such an important piece of the puzzle for patients and consumers. It also can save costs in the long run by elimination of duplication, and those costs can be better spent elsewhere, perhaps on prevention or expanding treatment and coverage to other people who may not have it. So it's really important, and I think a key component of moving to a more highly functioning and effective healthcare delivery system is having care that's connected, and this is part of that.